Welcome to Share, a podcast production of Amatis Recovery Centers. I'm your host, Kabir Singh. At the top of each episode, we like to remind our listeners that addiction is treatable and recovery is possible. If you or a loved one are struggling with addiction, call Amatis today at 855-80-SOBER or visit us online at amatisrecoverycenters.com. The opioid crisis has not spared any part of the United States, but according to a study co-authored by today's guest, there are regions where fatal overdoses are more likely. Dr. Diego Cuadros is the director of the University of Cincinnati's Health Geography and Disease Modeling Laboratory. His study found that across the United States, there are more than 24 hotspots for opioid overdose deaths, and that there is a profound connection between opioid-related deaths and mental distress. We hope that Dr. Cuadros will shine some light on what exactly is happening around the country. Dr. Cuadros, welcome to Share.
Thank you very much. Thank you very much for having me. I'm very excited to be here and to talk about our study about the opioid crisis in the United States and also here in Ohio, where the University of Cincinnati is located.
Wonderful, and we're very happy to have you as well, and excited to have you here. And we talked a little bit before this, so from here on out, I'll keep it friendly, and I'll call you Diego. And so, Diego, we have a personal interest at Amatis Recovery Center, certainly in the fight against the disease of addiction and those who helping those who are seeking treatment. We are especially thankful to you and being anchored in the University of Cincinnati. And we have a large footprint ourselves in Ohio. So we're doubly interested today, personally on a personal level, because of what we have there. And then, of course, the wide variety of listeners that we have out there as well in that region. So this is really an exciting episode. And, sometimes these are can be light and funny. We've had comedians on before, but we have educational specialists, PhDs like yourself, to be here with us to share. So we would like to get educated as much as we like to have fun.
Right.
So the basis of the study, could you sort of lay that out for us?
Absolutely. I'm actually going to start from the very beginning, because our latest publication is the second part of a study that we started 2 or 3 years ago. We started focusing in Ohio. So I'm going to start actually talking a bit about what we do in our lab, which is try to understand the spatial structure of different diseases, particularly infectious diseases, for example, HIV, malaria, even COVID-19. So this is very important information, because first we can identify vulnerable populations. So usually in epidemics, not everybody is at the same risk. For example, COVID-19, we can see that usually older population is the population at high risk of infection complication. In HIV is the same. And then we discovered that where most of the infections are located, or where the burden of the infection is concentrated, is a very important information for identifying this vulnerable population, and also for trying to target the intervention in these particular locations. So we were thinking about this opioid crisis. Of course, being here in Ohio, we realized that this is a very important topic, and it's a topic that we still, or is a problem that we still don't understand in the full extent. So we wanted to know more information about this crisis, this health crisis. And we thought that maybe it could be a good idea to implement this kind of approach that we have for other health problems, as I mentioned before, HIV, malaria, COVID-19, to this opioid crisis. So we wanted to know if everybody's at the same risk of maybe opioid addiction, and also if there are some particular areas that we can see that most of the opioid overdoses and deaths are happening. So we conducted that analysis here in Ohio, and we definitely discovered that we don't have a random distribution of the problem. We have what we call hotspots, of opioid overdoses and opioid death related, which was very important. And the second part, we identified that specific groups, particularly related with age and also related with race, were a high risk of opioid overdose and death. So we identified that the white male population is actually the population in which most of the cases are happening. But not just that, we identified that also these white males 30 to 39 are actually the ones where most of the deaths related with opioid overdoses are happening. And the second finding that I thought was very interesting was that the Black male population, even though is not the one that right now is suffering most of the problem, is actually in which the epidemic or the crisis is starting taking off very quickly. So the epidemic is growing really, really fast in this particular population. And the interesting part was also that it was in Black males 30 to 39. So as I mentioned before, this is what happened in Ohio. And then we wanted to see if the patterns that we're seeing in Ohio are actually patterns that are happening in the entire United States as well. So we conducted then the study at the entire national level, and we found very similar results. First, we identified that there are definitely not all states, not all areas are experiencing the same problem. The problem is concentrated in specific and particular areas. For example, here in Ohio, Tennessee, West Virginia, Kentucky, we have the highest hotspot of the health problem in this area. And the second part is that we confirm the situation about being the males, the white males, 30 to 39, the ones experiencing the highest burden of the problem. But also we confirm the situation about the epidemic growing in the Black male population. And the second part,
Doctor,
yeah, go ahead.
If I may interject on that one particular point,
absolutely,
with the males and the information you are extrapolating from these different hotspots, is so in all of the hotspots, it was it sort of congruent, the information that there's a rise in the Black male population and that there's already an established problem in that white male population? It was
exactly.
I see. Very, very interesting. And what was how was the female? You might be getting to this. So I'm interested to know. However, the female populations, was there?
It's a very interesting question because we, for example, and something that we can talk later, because this epidemic is a very complex epidemic. For example, again, I like to make the comparison with other diseases, let's say COVID-19, in which we have one single virus that is responsible for the health issue. And HIV, we're talking about one single virus.
Right.
In this opioid crisis, we have a way more complicated epidemiological situation because we don't have only one agent. We have several agents playing a role. For example, early in the crisis, we were talking about prescription opioids. And then when the epidemic was evolving, then we have the surge of, for example, heroin. And then in the latest phase of the epidemic, the one that we're experiencing now is synthetic opioids. So these new agents are actually the ones that generate differences in which groups are being more affected by the epidemic. So regarding the females, it was very interesting because there's some evidence that actually females are the ones who have more prescription opioids. So they have access to more prescription opioids. But they are not actually the group that is experiencing the highest burden of the problem. So we can see a quite big difference between the male population and the female population, with male population having at least twice the risk of opioid overdose compared to female population. So apparently there is some sort of substance abuse susceptibility in the male population. Why? We still don't know. It's the kind of questions that this research could produce. Sometimes in research you want to answer some questions, but actually what you do is that you start finding more questions that need to be answered. And this is one of the questions that we want to answer. For example, why females were accessing more prescription opioids early in the epidemic. The epidemic was actually start surging in the male population. So we can see a quite big difference between females and males, and in which males have much higher risk of substance abuse compared to females.
Thank you for that, Diego. It would seem to me as a layperson, sort of digesting this information that you bring out, that so here in treatment settings, so Amethyst Recovery Centers, it just so happens you could simply look at a dashboard on the censuses for any of the centers, and there's less women seeking treatment than men. I would sense that part of this problem is also the fact that women are often taking care of the household. I mean, not to be too much of a chauvinist here or anything, but just talk about the facts as I've seen them, and they're sort of they're maybe even easier for them to get what they need from their doctors for the facts of being women. So very dynamic information that you're aggregating here. So how long did this study take, or what period of time has this study been? Is it going on?
That's a very good question. So the data that we are analyzing actually is from 2010 to 2017. The problem is that we are using data about mortality from the CDC. Usually, these data take some time to be available for the public. So usually the CDC releases some preliminary information, but for having the entire data set, they kind of generate some cleanup, and it takes about 2 years. So that's why usually we have this kind of like a delay in terms of the kind of data that we have available for the analysis. But still, the important part is that we are able to see some tendencies. And for example, we know that there was some sort of small decline in the epidemic by 2018, but it took off by 2019 again. So increasing again.
Do we know why that was? Were you able to sort of identify in 2018?
That seems to be that because of and this is something that we can talk about later, about like why it's important to make this kind of research in terms of trying to identify the vulnerable population and so on, because most of the epidemic, or the way that the epidemic or this health crisis has been treated, is mostly by restriction, by treatment, like for example restricting the flow of opioids, usually prescription opioids, and also by treatment, like for example naloxone, which is a drug that is very effective reversing an opioid overdose. So for example, in Ohio has been a very aggressive campaign in terms of distribution of naloxone and access to naloxone. So pretty much the idea is that anyone who needs naloxone is going to be able to access naloxone. So this is very important, but again, based on other information that we have from other diseases, sometimes treatment is just part of the solution, but prevention actually is more important. And when you know who is actually vulnerable, who is at risk of these kind of problems, you can produce these prevention campaigns. So as I mentioned before, maybe for 2018, these kind of restrictions about the flow of opioids was taking a good effect, and particularly the aggressive distribution of naloxone. I think it was a very successful campaign, but it's not enough. And the problem is that now, as I mentioned before, because we have different agents introducing in the epidemic, changes the evolution of the epidemic. So now that we have synthetic opioids, which are more available, cheaper, and apparently start being, dispersing for the entire country, that's a new element that is introducing or fueling the latest stage of the epidemic, particularly for 2019. And also this is linked with about why the Black male population is now becoming one of the most vulnerable populations in the most recent phase of the epidemic.
So is that something that you're seeking to understand right now?
Absolutely,
yeah.
absolutely. So this is kind of like where we are mentioning is kind of like the discussion we have entre colleagues and also even people, like we have from the community. This is extremely important because we as scientists, we need information from the community. Is the people that that they are in the front line facing this situation, and they, for example, they have observations like the observation that you just mentioned about who is taking treatment and so on. So this is very important for us to try in order to understand what's happening. As I mentioned before, for example, naloxone seems to be very effective, but then because now we have synthetic opioids, and apparently synthetic opioids is becoming the dominant in the market, and it's becoming more available for particular populations because it's cheaper, because, for example, it was a lot of restriction for the prescription opioids, particularly for the Black population. Now that synthetic opioids is in the epidemic, emerging the epidemic, and seems to be that these kind of substances are more available for the Black population, and that's why we are seeing this surge of the epidemic in the Black population, particularly. This is what we are seeing, and this is what we expect for 2019 and 2020. Of course, in 2020, when we analyze the data, we need to introduce a new element, that is the pandemic.
Yeah, I would say, just as a person in the ground support, if you will, against the battle against the disease of addiction, and certainly overdoses, that the synthetic opioids, fentanyl, carfentanil, it is certainly permeating through all levels of society. I think
exactly.
you even have I've heard cases, folks not even searching for that particular drug. They maybe perhaps are buying Xanax off the street, and they end up buying a pressed pill of fentanyl.
Because it's contaminated. Exactly. They start mixing up the substances and so on. And their problem is that now we're talking about a more potent, a stronger substance in which people don't really know how to use it. Like, for example, in prescription opioids, it needs more doses in order to actually get an overdose. But for fentanyl and or synthetic opioids, very small amount of the substance could produce an overdose. So all these kind of elements that also are observations from people working with the community, of the observations that we are absorbing in order to understand what the data means, and also trying to understand the projections of what's going to happen next, and what kind of things we need to look at in order to understand what's happening right now with the epidemic.
Out of the hotspots that you have, the 24 or so, you certainly named, West Virginia, Kentucky, of course, Ohio. Are there, finer points? Those are states, of course. Are your hotspots generally states, or they're more narrow inside of those states?
That's a fantastic question, because it's a problem. It becomes a bit technical, this question, because it's when we're talking about scale. So when you have a national scale, you have these broad, large hotspots, in which basically you identify states or part of the states within the hotspot. So this is useful information. If you can start zooming in about the problem. And then, for example, in the analysis that we have for Ohio itself, we see that also within Ohio, the problem is not everywhere. The problem is concentrated in some particular counties in Ohio. And then if you go to those counties, you're also going to identify particular hotspots. Again, for example, in the city of Cincinnati, or in Columbus or Dayton, where we see most of the hotspots located there, you're going to see that also in those areas, you're going to identify particular areas, again, in which the problem is concentrated. So the question is that what kind of level of resolution you need, particularly, for this information to be useful. So of course, for the city of Cincinnati, we need the analysis to be run just for this small area and try to identify those
Right.
particular points. I know there are some groups that actually focus on Cincinnati, try to identify those hotspots, and most of this information is used for naloxone distribution. So they are trying to do is that they are trying to make naloxone available in these particular hotspots. But again, for our question, it was more about these socioeconomic and socio-demographic factors. So that's why at national level, with this kind of broad state level hotspots could be very important. Again, we're trying to identify some particular characteristics of the people that are getting some sort of high risk of substance abuse and potential overdose. But yeah, that's a great question, a bit technical, but
Yeah,
I
I can see how that could get very complex, and especially the data as it comes in, trying to drill that down. But thank you for, I did suppose there isn't enough time in the day for you to share these years and years of information, data gathering that you've aggregated. But you really put that in a good context for us to understand here today. This pandemic, perhaps just overall, you've seen maybe not so much nailed down the data yet, but it's likely, since you do this on a day-to-day basis, you're involved with this pursuit that you've seen a pronouncement in deaths during the pandemic, a rise in mental health cases, people who never even knew that they had, mental health, either some diagnosis or disorders, is starting to become more pronounced. Have you seen that over the last year? Probably starting to gather that.
Exactly. It's going to be a bit early to actually identify the impact of the pandemic in this opioid crisis, but for sure we're going to see that there is an impact. Why do we know that? Because, for example, in the previous study that we conducted, we identify this link between overdose and mental distress. This is a community level. So again, a bit technical, I hope it's not too confusing. So we have analysis at individual level in which we have information for each individual, and then we have information at community level in which we basically aggregate the information from several individuals, and we try to identify patterns. So the study that we conducted in terms of mental health was at community level. So we have information about aggregated number of individuals, particularly at zip code, at county level, and we identify those areas in which those individuals are actually having more mental unhealthy days are areas where we are also seeing a higher opioid-related deaths. So this is an evidence that we have this link between mental health and the opioid crisis. And also we have evidence that the pandemic definitely is affecting the mental health of individuals. Even in a personal experience, we can tell that, working from home, having this social distancing, and all these different elements that have been related with the pandemic have produced some distress, some anxious behavior in general that definitely have been affected the mental health in the general population. So based on that, we can assume that one of the potential no direct effect, but kind of like a side effect of the pandemic is going to be related with mental health. And we are going to need to study this, and we're going to need to understand this, because this is going to be very important after we, during the post-pandemic period. Then we're going to see all these kind of effects of the pandemic in terms not only in chronic diseases produced by the pandemic, but also in terms of mental health, and how this mental health is linked to other health issues like the opioid crisis. So definitely there is going to be an impact, and unfortunately a negative impact of the pandemic in the opioid crisis.
So it does certainly sounds like you have your work cut out ahead of you. The data is going to keep pouring in.
Absolutely.
Yeah.
It's the questions that we really want to answer.
So is this an ongoing study for you? Is it bookended at some point, or is it ongoing for you?
It's absolutely ongoing
Okay.
because we just started, again, all these epidemiological profile of the crisis. Only a few groups have been investigated or have been trying to answer those questions. Again, who is at risk, where people is located, and what kind of prevention measures we could do. Because again, a lot of the focus has been in treatment and terms of regulation of the drugs, or the flow of the drugs, but there is still, like the early phase in terms of what could we do in prevention. We're going to identify the people that are at risk, how we can improve the mental health of people, how can we help these people, what's happening with the white males, why in this particular age group are the males that are more susceptible, what's happening to us, like what's happening in this particular age that make us more susceptible to substance abuse, most probably not only in opioids, but maybe even in alcohol as well, and so on. So what's specific in terms of the socioeconomic factors, in terms even in the neurological factors that make us more vulnerable in this particular age? So all these questions are the questions that we really want to answer. We feel that we are in the early phase, and again, the pandemic is introducing a new element, and particularly affecting the mental health, and it's something that we really need to investigate, that we really need to understand, because I feel like there is a lot of things to do in order to control the opioid crisis here in the U.S.
I agree, and hopefully, Diego, you could come back and join us again and update us on your studies as they develop and continue and progress, because as I mentioned, it is fluid and dynamic, and you're constantly adding to it.
Absolutely. I will be more than happy to continue talking about this in the future. And again, I feel like we're going to find many other important elements in the crisis that are going to be very important for trying to reduce the mortality produced by this health crisis. And we hope we can contribute in this situation.
Wonderful. Well, there you have it, folks. Here at Share, we're always trying to keep you up to date with the latest information about addiction and recovery. We hope Dr. Cuadros has shined a light on this topic for you. While we scratch the surface, we're going to certainly have him back again and dive deeper into this study that he's doing here. If you or a loved one needs help with addiction, call Amatus today at 855-80-SOBER or visit us online at amatusrecoverycenters.com. You can find all episodes of Share at amatusrecoverycenters.com/share or download episodes wherever you get your podcasts. Thanks for joining us on another episode of Share. I'm Kabir Singh, and we'll see you next time.